Hi everyone, my name is Anita Ladhani. I'm a licensed clinical social worker and an energy practitioner. And today I want to talk to you about a very important topic. It's sexual abuse, but sexual abuse of our boys. A lot of us think that sexual abuse only happens to little girls, and nothing could be further than the truth. Now, I wish I had some statistics to, read to you guys, but unfortunately, I don't think we have accurate statistics when it comes to sexual abuse, and especially when it comes to sexual abuse of boys, because boys usually don't report it. In my experience in my line of work as a therapist and as a social worker, I work in an ER and I evaluate little kids, not little, 17 and under. And of course, I've worked with hundreds and hundreds and hundreds of patients over the last 20 years, whether it's my private practice or whether it's in the different environments, residential treatment programs, whatever I've worked in, I've worked with a lot of men. And of course, I have a lot of male friends who are very open and candid with me. And what I want to bring your attention to is how common, unfortunately, sexual abuse actually is. So let's talk about who it happens to. I think sexual abuse happens to boys and girls. And for boys, it could be as young as 3, 4, 5 teenagers. When does it happen? It can happen at any time. It can happen in any environment. How does it happen? With sexual abuse, it could be simple touching, groping, fellatio, oral sex performed by a one person on the child or on the teenager, or it could be actual penetration, whether it's a woman raping a male child, or it's a man penetrating a child anally. I know this is hard to hear, guys, but I'm sorry, this is not a pretty subject to talk about. Why does it happen? Sexual abuse is about power and control. So it's I don't think we'll ever truly understand or appreciate why sexual abuse happens. But it happens. It's very common, and it's very common in boys. So what are the effects of sexual abuse on boys? Well, I see boys, unfortunately, one too many times when they come in because they're depressed, they're anxious, they're suicidal, they're acting out, they're being aggressive. And as men, as boys grow up and they start to become young men, so let's talk about that. When sexual abuse happens to teenagers, a lot of times we kind of dismiss that thinking, well, they asked for that anyways, or, boys are sexualized, but that's not true. It's one thing for boys to be, hormonal and sexual, but it's another for them to be sexually taken advantage of without their permission. It's abuse. It's not a pretty picture. It doesn't feel good for you to have something done to you without your consent. So of course you've got depression, anxiety, acting out, anger, aggressiveness, moodiness. But then as they grow up, whether it's men or women, promiscuity, boys and even girls who are sexually abused end up, not all the time, but a lot of times, being very promiscuous as teenagers. They'll very casually, have sex with multiple partners and not think anything of it. As young men and as adults, they'll have a hard time committing in a relationship because they have commitment issues. They have extremely low self-esteem because who they are, a lot of times, because of the sexual abuse, has been shattered. They're also unable to express intimacy. So they're able to have sex, but they're not able to make love. And there is a fine difference between that. So what do you do about it? What do you do about it? I think as parents and as adults, we have to guard our kids just as much as we would guard our boys just as much as we would guard our girls. We're very careful about making sure, we don't leave our girls overnight, or we watch our girls a little more carefully and supervise them more, but we tend to be very casual and careless with our boys. We can't afford to do that because, unfortunately, like I said, boys are getting molested just as much as girls are. I remember an Oprah Winfrey show, I think almost, gosh, 20 years ago, if not, around that time. And I remember her having a studio full of men who had been sexually molested, and they were all holding a photograph of themselves at the age that they were sexually molested. I will never forget that show, and I'm sure you could Google it at some point and find it on YouTube. It was grown men, some as old as their 50s and 60s and 70s, and of course young boys and young, all the ages through, holding pictures of themselves when they had been sexually molested. So sure, we all have, that idea of, kids getting molested, in by the priest, or getting molested by the coach. Kids could get molested by the neighbor. Kids could get molested by an older sibling. Kids could get molested by a older family member. Unfortunately, this is a sickness that's out there, but it's our responsibility to keep our kids safe. So what do? Don't just leave your kid with anyone that you don't know. And even if you know them, trust, but really monitor. Create an environment with your child so you're able to talk about this kid. Now, what happens with abuse survivors is that there's a level of guilt and confusion because your body is physically wired for pleasure or pain. So when kids are being sexually molested, they inevitably experience a certain degree of pleasure because unfortunately, if you touch someone nicely or in any sexual way, you're going to get aroused. So in boys, the arousal is very evident. They get an erection. And boys feel that they asked for it or they enjoyed it. So there's a higher level of guilt in boys and girls. And so it's very confusing for them because they think, well, I had an erection, so I enjoyed it, so maybe I wanted it. And this is this whole sort of conflict that goes on between them. Talk to your kids. Talk about safe space. Talk about, your physical body and create, there's lots of books on this, on helping parents talk to their kids when they're very young about safe space. Tell kids there's safe touch and unsafe touch. Who is it okay, to be changed in front of, and it starts young. We are very careless when our kids are little. Oh, we can just change your diaper, or we can just change, you in front. No. Very young, start to respect the kid's physical body. Give them their privacy. And once they're old enough, teach them about safe space and unsafe space. Teach them about, yes, doctors can touch you within reason as long as mommy and daddy are in the room, but nobody else should be able to touch you. Mommy can help clean you and daddy can help clean you and as you're getting older when you're potty training or whatever, but other people cannot do that. So identify for them what's appropriate and what's not appropriate and create that environment, create that relationship with your child so that they're able to come and tell you without any feelings of, being punished or guilt. And they're able to tell you, hey, I was abused or I was touched inappropriately, whoever did it. And if you are an adult, if you are a man or a teenager, whoever's watching this, or if you know someone who has been sexually molested or abused or raped, encourage them to get help if they're ready to. Therapy is a great way to start. It's unburdening and unpacking these emotions that you've buried away. And sometimes just the mere act of talking about it is release enough. I hope this has been helpful. The intention of all of this to always spread awareness because unfortunately this is too common. So let's stop this and let's I would love to live in a world where this is not an issue. If you have any questions, you can always reach out to me. Love and light. Take care. God bless. Bye.